Governor Hochul of New York declared a state of emergency on Friday over the growing polio outbreak, in an effort to better equip healthcare providers with tools to curb the spread of the sometimes disabling virus before it takes further hold in the state. The order allows emergency service workers, midwives and pharmacists to administer the polio vaccine. The declaration also requires healthcare providers to send polio immunization data to New York health officials so that they can determine where in the state to target vaccination efforts. On polio, we simply cannot roll the dice, Dr. Mary D. Bassett, the state health commissioner, said in a stop. Do not wait to vaccinate. The first polio case in nearly a decade was identified in July in New York State. Officials said an unvaccinated man in Rockland County was infected by a virus that had been shed from someone who received the oral polio vaccine, which has not been administered in the United States since 2000. The oral vaccine is safe, but contains small amounts of weakened live virus that can circulate and strengthen if communities are undervaccinated. No other cases have been identified by the state, but officials have been monitoring wastewater for polio, which is typically found in the fecal matter of an infected person, to track whether the virus is spreading. In August, New York City officials said they had identified polio in the city's wastewater. On Friday, state health officials announced that they had identified polio in 57 samples collected from wastewater in several downstate counties between May and August. The majority of the samples were collected in Rockland County, and 50 of them were genetically linked to the case of the Rockland resident. 13 of the wastewater samples were collected in Orange County, 6 were collected in Sullivan County and 1 was collected in Nassau County. State health officials have marked 7 of the samples containing polio as a particular concern because they have not been linked to the Rockland County case. The polio vaccination rates in counties where the samples were collected are lower than those in the rest of the state, according to state data published in August. The statewide average rate for polio vaccination among children under 2 years old is around 79%. The rate in Rockland County was around 60%.